that extends all the way from the skull down to the shoulder and then down to the vertebral column. It's shaped like a trapezoid. Right here. Trapezius. The trapezius is interesting because we don't have to contract the entire muscle all at once. We can contract just part of the trapezius. But let's look at its origin. It originates from the occipital region of the skull. Within the cervical spine, it originates from the nuchal ligament. The nuchal ligament is a yellow ligament. It's made out of elastic fibers, elastic connective tissue, that tethers together the spines of the cervical vertebrae. So the spinous processes. Okay? So it's originating from soft tissue, the nuchal ligament, and then around C7, it attaches to the spinous process. And it also originates from the spinous processes of all the thoracic vertebrae. Okay? So, again, it's originating here from the occipital region of the skull. It's originating from the nuchal ligament here. And it's originating from all the spinous processes extending down the thoracic vertebrae. Now, it's going to insert. Where's it going to insert? It's going to insert, this is the scapula here. This is the clavicle forming the shoulder joint. It's going to insert upon the distal third of the scapular spine, like this. It's going to insert upon the acromion process here. And it's going to insert upon the distal third of the clavicle, like this. Now, it's not only inserting up from above with these upper fibers, but from its medial aspect along the vertebrae. And then some of these fibers are coming from below, like this. Okay? So we have upper fibers, we have middle fibers, and we have lower fibers, all inserting upon these same three structures: the spine of the scapula, the acromion, and the distal third of the clavicle. Now, when these upper fibers contract, what are they going to do? They're going to raise the shoulder as if you're shrugging. Okay? We talked about that before. We said when we test the accessory nerve, we have the patient shrug. They're contracting these upper fibers. If you contract these middle fibers, they're going to pull on the shoulder like this, on the scapular medially. And so what happens is you pull the two scapulae closer together. And that's called adduction toward the midline. So if you're standing at attention, like this, that would be these middle fibers pulling or adducting the scapulae. And then when the lower fibers are working, they're pulling down on the shoulder. They're depressing it. They're bringing it down. So depending upon which fibers are active, the trapezius can either elevate the shoulders, it can cause adduction of the scapulae, or it can cause depression of the scapulae. When I say scapulae, I mean the shoulders. Okay. The function, the innervation, I think everyone knows this already, is the accessory nerve. Now, we can use the attachment to the skull as the insertion. That means with the rest of the muscle fixed, okay, we can do this. We can contract these fibers that are attaching to the occipital part of the skull, and when we do so, it lifts the head. Okay. Extends the head. So when we say yes, like this, sternocleidomastoids, trapezius. When you're passing somebody in the hallway and they give you one of these, trapezius. Trapezius. Okay. Now I'll tell you what's interesting about we're going to skip one. We can skip a couple and go down to the deltoids. Okay. These sites of attachment for the trapezius in other words, the scapular spine, the acromion, the distal third of the clavicle. All of those sites are the sites of origin for the deltoid. In other words, the deltoid is going to arise from the spine of the scapula. It's going to arise from the acromion process and from the distal third of the clavicle like this. Okay? It's going to cross the shoulder joint and it's going to attach to the humerus along that ridge that we call the deltoid tuberosity. So the insertion of the trapezius becomes the origin of the deltoid. Okay? And of course, when we contract these fibers here and pull up on the humerus, like this, it's going to cause the humerus to do what? What do we call this motion of the humerus at the shoulder when we do this?
Abduction.
Abduction, abduction. So when we're testing, so what nerve is that causes abduction at the shoulder? What nerve is that? No, that's this. What is this? Axillary nerve. The axillary nerve innervates the deltoids. Did somebody say that?
No.
Okay. And so when we're testing the axillary nerve, we'll have a patient do this. Can you hold your arms up like this? And we'll say, okay, don't let me push down. Okay, and she's nice and strong. So that tells me that that axillary nerve is intact. Then let's look at, by the way, you can tell here, here's the trapezius. Okay, it's attaching upon the spine here, the acromion around here, and it's the same site from which now the deltoid's originating. So, for instance, here in red, they're showing the origin of the deltoid. All the way around like this. Okay. These are also the sites of insertion of trapezius. In this picture right here, this muscle coming up right here, coming over, coming down, this is all trapezius. This right here is the origin of the deltoid. It's coming around the shoulder, coming down. Let's see. Where do we go here? Let's go here. Pectoralis major. It's originating from the medial part of the clavicle, the sternum, and the costal margins of the first 6 ribs. Let's have Skinny turn around. Remember that origins are in red. Okay? So this right here, this area here, represents, and the costal margins here represent the origin of the pectoralis. Now, the pectoralis, these fibers are going to extend to the humerus and insert along this intertubercular groove.
Dr. P?
Yes.
We can't see.
Is that better?
No, like we couldn't see when you were like explaining because you were blocking the view.
Okay. Can you see now?
Yeah, now explain again.
In
Please.
red,
Okay.
origin, insertion along the intertubercular groove.
All right. Okay.
So when it contracts, it's going to pull medially. It's going to pull the humerus medially. It's going to pull it in. So one of the major functions of the pectoralis major, whereas the deltoids are responsible for abduction, the pectoralis major, adduction. Not only adduction, but because it's pulling along the intertubercular groove, it's going to do this. It's going to allow medial rotation. So it's not only adduction, but it's medial rotation. I think there are machines at the gym. I don't know if they call this a butterfly machine, where you grab hold of these handlebars and you do this. Okay? Well, that's strengthening the pectoralis major. That's the movement that is mediated by the pectoralis major. It's this movement here. Now, some of the fibers, if you look closely up here, that are attaching to the intertubercular groove are coming from above. So when these fibers contract, they're going to pull up on the humerus. So the other function of the pectoralis major is to flex at the shoulder. In other words, to bring the humerus or the arm up. So flexion at the shoulder is another important function of the pectoralis major. So it's not only adduction and medial rotation, but also participates in flexion at the shoulder. Say something about the pectoralis major. I want to say something, one more thing. Now, I'm not going to have you memorize the nerves. They're called the lateral and medial pectoral nerves. But these nerves carry fibers from C5 through T1. Okay. So, what does that tell you in terms of the plexus?
Cervical.
Well, not cervical, but brachial plexus. So those nerves, those pectoral nerves, originate from the brachial plexus. So if there was damage to the brachial plexus, it could impact the pectoralis major. Okay, because you know that the brachial plexus is C5 through T1. I'm sure this one's for you.
Oh yeah.
Okay. Let's see, let's go back. There's something else I want to show on this one here. Dancing it up somehow. That's it. Oh, let's do this. Now, the next muscle we should discuss is the widest muscle along the back. The term for widest is latissimus. Latissimus dorsi literally means the widest of the back. So if we look here, this is the latissimus dorsi. Okay. It extends across the back bilaterally.
You said this is the widest muscle?
The widest, that's what latissimus means, the widest. Now, you can see that it's originating from the large part of the vertebral column. If you turn skinny around, I'm going to try to do it so that you can see this, Tom, JJ, is that the lower 6, 12, 11, 10, 9, 8, 7, these spinous processes, so the lower 6 thoracic spinous processes, the lumbar spinous processes, and then the iliac crust on either side. These are sites of origin for the latissimus dorsi. Now, these fibers are going to do this. They're going to pass along here and then curve so that they attach onto that intertubercular groove. Just like the pectoralis major, they're coming from behind, though, and attaching. But because they're pulling medially, they're going to share certain functions that the pectoralis major has. These fibers are coming medially and attaching to the intertubercular groove. They're going to assist with adduction and medial rotation. Okay, just like the pec major. So what we're going to find is there's a group of 3 muscles, pec major, latissimus dorsi, those are 2 of the 3, that insert upon the intertubercular groove from a medial position and therefore are going to bring about adduction and medial rotation. So those 2 functions are in common with the pec major. Where it's different is that because these fibers are coming from a posterior position to attach, they're not going to assist with flexion. Instead, they're pulling from behind and extend, so they're going to cause extension at the arm. So when you do hammering, boom, 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 you're using the latissimus dorsi. When you swim, okay, you're doing this stroke down here. You're bringing your arm down against resistance through the water, latissimus dorsi. When you're climbing, okay, you're forcibly extending the arm. That's latissimus dorsi. Any type of motion like this, if you're a carpenter, latissimus dorsi. Who wants to demonstrate this? Okay, come on up, Hunter. So, if I'm Hunter's latissimus dorsi, okay, I'm coming from, so hold your arms out a little bit, like this. I'm coming from behind, and I'm pulling like this, okay? So as I pull, I'm going to pull in, and then I'm going to pull back. So again, it's extension, but it's also going to contribute to this movement here. This, right, and then medial rotation. So it's like this. That's it. Thank you. Now, I want you to notice something. If we take a close look at Tiny.
Was that planned?
So the latissimus dorsi is coming up like this, and it's going to insert upon that intertubercular groove. There's another little muscle right here, right above it. This is called the teres major. It's going to originate from the inferior angle of the scapula. Right here. See in red right here? It's going to join the latissimus dorsi in inserting upon the intertubercular groove. So, look, it's moving in the same direction. Its fibers are running parallel to the latissimus dorsi. And it's inserting at the same site, the intertubercular groove. So that it's going to have all the same functions. In other words, it's going to bring about adduction, medial rotation, and extension. For that reason, the teres major is called the mini lat. The mini lat. It's a mini latissimus dorsi. Okay? Its fibers are in the same direction. They attach to the same insertion point. Okay? Their functions are the same. Again, as with latissimus dorsi, you don't have to know the innervation for this one. So then that gives us the three muscles, pectoralis major, latissimus dorsi, and teres major, that share two functions. They all share adduction and medial rotation.
Wait, dang it. What was those three muscles again?
The pectoralis major
Okay, latissimus dorsi
and the teres major,
teres
which is the mini lat.
and those are the muscles of
Adduction and medial rotation. Wow. So look here. Just like that, we've covered the first page. Are you all looking forward to the end of the semester?
A little bit.
Yeah. I think that what happens is by the end of the semester you get a little bit burned out.
For sure.
But you gotta start the same stuff next semester. So.
Oh no, AP2 is different from AP1.
But I need to still study the body, so.
But that's what you're passionate about though, right?
Yes.
That's what you were born to do. You wanted to become what, a nurse?
Yes.
Okay, so that's what you have in store.
Yeah, actually, I wanted to be a hand surgeon.
Oh.
Yeah.
You know, it'd be a lot more school than this.
And I have carpal tunnel, so I don't think it would let me actually.
Now, what is this muscle right here?
Latissimus.
This is that teres major, that mini lat. Here, number 10, this is the latissimus dorsi. So you can see that the fibers are right next to each other. They're running in the same direction. They're both going to extend and insert upon that intertubercular groove. What is this muscle, number 5?
Deltoid.
Deltoid. What is this one here?
Trapezius.
Trapezius, yeah. What is this one up here?
Major.
Where's that one?
Deltoid.
Deltoid. Do you remember what this one's called?
Rectus abdominis.
Rectus abdominis. What about this one here?
Internal.
Internal, because the fibers are running slightly upward. Whereas here, you can see they're frankly horizontal. This is the
And
transversus
transverse.
abdominis. Transversus abdominis. What is this one called with all these slips?
Serratus anterior.
Anterior. Serratus anterior. That's correct. Okay. Let's get out of this one. Y'all got big plans for the weekend? Sometimes it's good just to be home. You know, sometimes it's nice.
What? Yeah.
Where do you work?
I will change my papers the day of.
Oh, okay. Where is that reported? Okay.
I used to be in the water.
Is that on Pienso?
No, South Carolina.
Okay.
Father died young.
Okay.
You get a lot of tips.
Yeah.
Oh,
You can make big money.
I made a
Could
lot
we
more
be-
downtown.
Oh, yeah.
I made like $800 a shift.
Oh my God.
You're kidding me. Wow.
That's doctor said stuff.
I know that's why I got accustomed to this lifestyle.
I bet when you do that though, that kind of work, you have to hustle the whole time, huh?
Oh yeah, that's like 12-hour shifts, 16-hour shifts.
where's it at?
That was when I was working at BBC in Crazy Corner.
Oh, okay.
Got this $700 car.
But you gotta customize though. I wanna.
Don't ask anybody to pay me.
So Kim gives me.
Yes.
Yeah.
I don't think I would have to get a
Yeah, I'll
custom baby doll.
I got a train for him.
Sure. So I ate like 20 minutes yesterday. That's what I ended up getting. And I ate them in like 5 minutes.
I was like in the penis.
I had food at home.
Oh, brother.
I did too.
Huh?
I made a
I ran this full.
spinach cheese quesadilla.
Oh, quesadilla, okay.
I don't know, he's got to look at it.
Spinach is dope.
He has $5.
I have to buy it.
Spinach either?
Oh well, I don't know. Spinach. Like spinach dip.
Just drown it in cheese.
Well, we did the when it's not healthy.
Yeah.
But on a sandwich. Like when my dad gets the
Then I know.
spinach from Hong Kong market, and it's like, you know what I'm talking about? It's like
Wait,
green.
I don't go to
Wait, Oreo green.
What kind of history does your husband know? Louisiana?
Yeah.
World?
He's from New York though. So he knows a lot of like
We're moving on to the.
Knows about the Roosevelts?
I'm sure. He knows
No,
everything I don't know.
This
so I
is
don't know anything.
connecting your
And he's older than me. But I feel like he's got a way
shoulder
older
joint,
soul. Like he's
whatever
like
this is
50 or
called.
60.
Like this is your.
It's just
What
like
did we call this?
as if he was living back
Your
You would probably know all
girdle.
about the history of the Roosevelts then, because they're
Girdle,
from New York.
girdle.
Yeah. He was born in Jamestown.
Jamestown.
Penis.
Oh my God.
No, I don't know.
The old settlement?
We're just doing the girdle stuff now. We're doing the arm stuff.
Dang.
Do you use the gas mask thing? What is that called?
Gas mask.
You know what I'm talking about? The mask they use when
How old
they're
are they?
Oh hell no, I'm not that lame. I don't wear gloves and all that.
They do like move the tires. I've seen
I've done that. Yeah.
I guess you get more oxygen, or you don't.
No, it limits it.
Make
It's
sure
like
you
it's
We are
strange
eating in
to
the
yeah.
cafeteria today, by the way.
That's probably not good.
Fried shrimp.
Is it fried shrimp
It's
today?
not fried catfish.
No, I know. It's not fried catfish. It's fried shrimp.
As long as it's not that barbecue.
I know that barbecue pasta. Oh God, no, it's so
That doesn't even
disgusting.
sound good.
Is their
No, that's
catfish
what I
good?
Barbecue catfish is usually good.
I haven't had good
Got
fried
to
But
talk
they-
about,
they
oh,
don't
that's
have-
good. No, it isn't.
Awesome.
You don't like the shrimp?
No, that barbecue pasta that you tasted.
Oh
remember?
wow.
Oh, you didn't like that? Okay.
I've never heard of barbecue.
And then-
Alright, so do y'all remember
Just
these phones
thinking
here?
about his menu.
Yeah.
The olive
What is this rating of 7?
All no.
No?
Radio. I was just about to say,
It's been
it
a
looks
long
like the
week.
radio.
That's the radio.
Oh,
That's
yeah.
the radio. That's the radial tuberosity.
Weird angle.
Now, the important thing about the radial tuberosity is it serves as the insertion for the biceps.
That's right, Kat. He's never wrong. It's a good point.
See?
So this would be the older, and you know it because
Oh,
this
the
is what? Here's
Olecranon.
The Olecranon.
the Olecranon, yeah.
I think you can point to the thing above it.
So 14, here's the Olecranon. What would number 16 be?
No.
No.
Oh,
It's
wait.
a,
That's the
it's a depression.
Oh.
The Lebanon pasta.
Olecranon fossa.
Yeah, you go.
Fossa.
The insertion radius
Where did you get
velocity.
So wait, where's Capitulum then.
What's that?
That's on the
The capitulum's underneath it. No, to the left.
The
of it.
capitulum, we don't really see it well on here.
It says number 11.
No.
Where's number 11? To the left.
To the left.
Oh, right here.
Yeah, okay. There we go.
Wait.
That
What muscle?
Now, let's look here.
Is that what he's saying?
Mhm.
Bicep?
This is number,
I'm gonna just be quiet.
number 5. What is number 5?
Coronoid process.
Of the ulnar. Okay? So, the two muscles we're going to talk about next, the biceps is going to attach to the radial tuberosity, and the brachialis, which sits deep to it, is going to attach to the coronoid process. And when these two muscles contract, they're both going to lead to flexion at the elbow, flexion of the forearm at the elbow. So this shows here the biceps. Biceps indicates that it's got two bellies. Okay? And so proximally there are two tendons. One is a long tendon that's passing through the intertubercular groove, and it's going to attach to the supraglenoid tubercle. It's a little projection just above the glenoid fossa. Okay? So that's the long head. The short head is going to attach directly here to the coracoid process. So there are two muscles that attach to the coracoid process, the biceps and the pectoralis minor.
Come on now.
The biceps and the pectoralis minor. Okay? Now, distally, these two bellies fuse together, creating one tendon that attaches to the
Radial
radial tuberosity. Right.
Wait, that come out right.
Now, so this muscle is actually crossing two joints. It's not only crossing the shoulder joint, but crossing the elbow joint. So at the shoulder, it's going to contribute weakly to flexion, and it's going to also contribute to flexion at the elbow. Okay? Now, it's not only going to contribute to flexion at the elbow, but do this motion here, like you're turning the handle of a door, or you're doing a light bulb. Okay? What is that? What do we call that motion? What is it?
Is it rotation?
Well, no, there's a special name for it, where we go from here to here.
Supination.
Supination, right. So, biceps contributes not only to flexion at the elbow, but also to supination. And you can feel your biceps contracting when you do that movement.
Biceps.
Okay. So, what nerve innervates the biceps? Musculocutaneous. Yeah,
From the brachial plexus.
from the brachial plexus, that's right.
Wait,
Now,
you really
there's a
said-
muscle that's just deep to the biceps.
You know what?
That was on
You
the
remember
this
this one?
morning.
Brachialis.
Probably
Yeah,
all
that's right.
frazzled
This was the
from your
first time.
double.
Definitely.
We're like about to be late. Almost 1 minute
So,
late.
That's
Right?
the small one
That's
right
probably
there.
so keen.
this is
I would have stayed.
This is the biceps, this is the long tendon, this is the short tendon. The long tendon, remember, passes through that intertubercular groove. If we remove the biceps, this muscle that sits deep to it is the brachialis. It's attached to the shaft, the diaphysis of the humerus. Distally, it attaches to the coronoid process of the ulnar. Okay? So here, you see it originates from the shaft of the humerus. Distally, it inserts upon the coronoid process of the ulnar. It's crossing only a single joint, the elbow. So it's going to assist the biceps with flexion. It's innervated by the same nerve, the musculocutaneous. Let's turn around. Let's where's my stick? I put it
Okay,
somewhere.
you right here. You should just stop putting down the stick.
Yeah, you're right. You're right, but I can't do it subconsciously. All right, so now let's look at this muscle along the posterior or extensor surface of the arm. This is the triceps. It's called the triceps because it has 3 bellies and 3 sites of origin. Okay, so, and its formal name, by the way, is the triceps brachii. So for the biceps, it's the biceps breaking. For the triceps, it's the triceps breaking. And just like the biceps, it has a long head. The long head here is attached to the infraglenoid tubercle. There's a little projection that sits just below the glenoid fossa, to which the long head attaches. The other two heads originate from the shaft of the humerus. Distally, the triceps inserts upon the olecranon. Now, when it contracts from behind, it pulls on the olecranon and extends at the elbow. So it's responsible for extension of the forearm at the elbow. What is the nerve that innervates the triceps?
Radial.
Radial nerve. In fact, the radial nerve innervates all of the extensor muscles along the posterior aspect of the arm. Okay? Now, there's one more muscle we have to look at with respect to the upper extremities, and that's the brachioradialis.
Yeah, brachioradialis.
It's attached to the distal, it originates from the distal shaft of the humerus and inserts upon the distal radius near the styloid process. Okay. This is an exception to the rule. It receives innervation, even though it's going to be a flexor, not an extensor, it receives innervation from the radial nerve. So that's kind of an exception to the rule. So it's going to be a synergist. It's going to assist with flexion at the elbow. I want everybody here to kind of pull up their sleeves and see if you can find your brachioradialis. Do you see it? If you hold your arm like this, it's going to kind of come like this.
This one?
More like this. It's going to be this muscle here.
This one right here.
That's it.
When you flex.
Yes, this you got a nice one.
Oh,
Is it right here? So
I got a nice.
Flex.
Hold on one second. Let me get something here.
Are you flexing?
Yes.
I got like, ooh.
It's like
Oh, it's right here.
I want to be
This is
the
different.
example.
Not no less.
You got cool. You got it.
jerking off building.
Let's see.
What?
This one right here. Like shake hard. Really shake firm. Give me a firm
Right,
grip.
too.
It's right here.
Right there.
Okay. Now,
So what happened? You about to do that?
well, you can do a reflex on any muscle, but let's see if we can do this. Just relax. It's all about. Okay. Let's see if we can do this. That's not how
I'm
it's supposed
joking.
to
I'm
go.
joking.
The problem is I want to use the small end, but it's not. Let's see if we
I
can do
was
it.
trying to solve.
Relax this elbow as much as you can. You see that?
Yeah.
All right, so what happens is then the wrist comes up like this. It initiates flexion.
Oh.
So again, even though this is a flexor muscle, it's innervated by the radial nerve. So that's kind of a little bit of an exception to the general rule. All right, what muscle is this here? Can you tell? That's the biceps muscle here.
It has
Yeah.
the two
It's
heads.
got the two heads. Okay, one of which is going to the coracoid
Is the
process.
first one the long head?
This is the long head, this is the short head.
See, but I know, but the one at the right looks longer than the one at the left.
It can look that way in the dark. Now you're missing part of it here, because it's covered by ligaments.
Oh, okay.
And what is this muscle here?
Is it the
It's deep to this.
brachialis?
That's the brachialis. Okay? What is this muscle? Let's turn the lights up here. What is this muscle here?
Pectoralis minor.
Pectoralis minor. It's coming from the same site where this biceps tendon is going to. This is the coracoid process here. What muscle's been cut away here?
Deltoid.
Deltoid. So what muscle was this part of here?
The trapezius.
Trapezius, yeah. Yeah. What about this one here? Can you tell what muscle was cut?
Sternocleidomastoid.
Sternocleidomastoid, that's correct. What muscle was cut away here?
Pectoralis major.
Pectoralis major, very good. Okay. Now, this would be that brachioradialis.
Okay.
Now we're looking at a view from behind. Okay. So what muscle is this here?
Triceps.
Triceps. All right, JJ, I'll put this for
What
you.
does that mean?
No.
What muscle is this, JJ?
That's the bicep.
Biceps, that's correct. Deltoid, what is this?
That's the
Major.
Radialis.
Radialis.
Brachioradialis.
What you just said, Brittany?
I said brachial.
The last thing.
I know what I'm.
Okay. All right. So that brings us to the lower extremities.
Yeah.
And let's do this. Let's cover the first two, the iliopsoas and the sartorius, and we'll call it a day.
Sweet.
Now, the iliopsoas
It's two.
it's one of those bipartite muscles. It actually has two different muscles that contribute to it, just like the occipital frontalis. All right, the first muscle that contributes to it is called the iliacus. The iliacus.
Oxus.
The iliacus.
Oxus.
This one is crazy.
What are you doing the oxus for?
What?
Okay. I mean, there's
Yeah.
two. I'm gonna just think of the iliac. No, the iliac. Mm-hmm. Oh.
Iliopsoas.
Oh. Okay. Yeah. That. Ox.
So
Yeah. This one's not over.
Got my
Thanks.
45 and 2
Oh, that's right.
I'm gonna stop it because your eye muscle.
Baby, that's all
Iliacus and the psoas major
Wait, I don't see it.
equal
Oh, they equal that.
iliopsoas.
Ilio. So, oh, okay. That's
Now, the iliacus originates from this iliac crest and this anterior portion called the iliac fossa. Fossa. So its fibers are originating from the iliac bone here. Now, the fibers are going to pass deep to the inguinal ligament. They're going to pass deep to the inguinal ligament, and they're going to, let's move Skinny around, and they're going to insert upon this lesser trochanter. So they're passing from up here, they're going to pass deep to the inguinal ligament to attach right here. So if we look here, this is the iliacus. The fibers originate from the iliac crest, from the anterior fossa, and then they're passing deep. Here's the inguinal ligament. So they're passing deep to it, and they're inserting upon the lesser trochanter. So they're crossing the hip joint. Okay. Now, its bestie is number 3. That's the psoas major. Okay? The psoas major is going to originate from the transverse processes of the lumbar vertebrae. Okay, so it's attached to these transverse processes, and then its fibers are going to join those of the iliacus, pass deep to the inguinal ligament, and they're going to also insert on the lesser trochanter. Now, notice that this muscle is passing deep to the inguinal ligament. There's a structure, a nerve that's passing deep to the inguinal ligament at the same site. What is that nerve called? Femoral nerve. So the femoral nerve is going to provide irrigation to the psoas major and to the iliacus. All right. So when this muscle contracts, what do you think it's going to do? What movement is it going to mediate?
Flexion.
Yeah, you can think of flexion of the thigh and the hip like this.
squat or something.
Now, what's that?
Maybe when you squat or
Well, when you squat, but more so, let's say when you go to kick a football.
okay.
Now, it will also assist with taking a bowel, because really that's the same movement. So the iliopsoas gets innervated by femoral nerve. Okay? Now, if we look closely here, we're going to see another muscle that's crossing the thigh that originates from this structure right here. What is this right here, number 6? What do you think that is?
As is.
As is. So there's a muscle that's going to originate from as is, and it's going to cross the thigh from lateral to medial. It's going to go right across it. Okay? And then it's going to insert along the medial aspect of the tibia. Okay? Let's see if we can find that muscle on Tiny.
Tiny getting on my nerves.
It's interior and inferior.
You see this muscle here that's starting as is,
Mhm.
that's crossing medially to attach to the medial aspect of the tibia. That's called the sartorius.
Oh, it's so ironic because my legs are crossed.
That's
When
right.
I'm sitting, used to cross one leg over the other. That is very, very ironic. That muscle look like it's so easy to like tear.
So I think of it. Well, I'm not going to draw this.
It's too much.
It's too much. But it's called. Have you ever heard the term sartorial splendor? What does sartorial refer to? It refers to a tailor, a men's dress.
Oh, okay.
I've heard of
Would have never guessed that.
Okay, it's the muscle it's called the tailor's muscle, because oftentimes, I don't know if anyone's ever been to a tailor,
Measure around there.
but a lot of times when they're measuring like your pant leg, the tailor's sitting down on the floor with his legs crossed, or at least one leg crossed. Okay, and so all of those movements of the lower extremity are mediated by the sartorius muscle. In other words, you have your sheet of paper here? It says the sartorius, when sitting, is used to cross one leg over the other. It's going to be responsible for flexion, lateral rotation, abduction, and then flexion of the knee. So all of those movements that you associated with crossing your leg, where you flex the hip, you laterally rotate it, you abduct it, and then you flex the knee.
So the sartorius is very important.
Yeah, you would think, yeah, for taking that position. Flexion, abduction, laterally rotating, and then flexing the knee. All of that. Now, because it's crossing the anterior thigh, it's right in the pathway of the femoral nerve, it's going to receive its innervation from the femoral nerve. Okay. So again, iliopsoas, sartorius. Now, we get it figured out.
You just like to go.
No. I'm trying to get
What?
No way.
If you come up here, this isn't a plain film, but it's an IVP.
Oh, that's cool.
But you can see the shadow of the psoas major right here. One of the diagnostic findings associated with appendicitis is that there's a loss of the psoas shadow with inflammation of the appendix. So that psoas shadow is important in terms of radiographic diagnoses. All right, now that leaves us on Monday to cover the rest of the muscles of the lower extremity. Okay, so what I would urge you to do is start studying these muscles now. We'll probably have a quiz on Monday. Okay, so study these muscles. The quiz will help you to study them, help you prepare. Don't try to learn all the muscles at the very end, right before the test.
Wait, when's the test? Is it when we come back from Thanksgiving?
I think it must be.
Yeah, I can't say honestly.
That when we come back from Thanksgiving, we have Monday, Wednesday, and Friday, right?
Wow, and that's the end?
So it's probably going to be. I haven't checked the date, but it's probably. Let's see what day it is.
So then we have the final.
Let's see what day this is.
was on Friday on the schedule, but he's probably gonna move it up.